Look the movement. Yes. Wiping movement, no? And sometimes initially I train my junior, all juniors, this way John Barabar. This is that. Why water is more important? Because if you see the water coming from the lower area, okay, that area, the black area, no? So you should reach the up to electrode. Otherwise, how the plasma formation? Look here, plasma formation less. So if water pressure will be there, then plasma formation will be good. First on one side, now I am cutting from the left side, okay? 80% adenoid tissue will be done in the same side. Sometimes, yes, sometimes pipe. Look here, slowly, I am debarked that tissue. If you go the more lateral, there is a chance of getting, okay? Don't go, because the out of control. And my target is the, all time look here, 3 electrodes, all time under vision. 3 electrodes under vision. Ground electrode, not within the tissue, should not go within the tissue. So ground electrode, all time under vision, only electrodes go. Look here, slowly, I am showing the slowly, look here. Look, another movement, look here, the movement. Lots of tissue I am engulfing at a chance, okay? In old setup, the speed is much more because the water pressure, everything is in your side. So I will finish off tonsil within the 10 minutes. And tonsil, yes, adenoid within 10 minutes and tonsil within the 2 minutes. 2 tonsil, 2 minutes is the normal time. So within 15 minutes, tonsil adenoid will be finished. Then I also sometimes getting the plane sometimes difficult. So your choice, but I prefer and I train doctors from upper pole, start from upper pole, because the upper pole, if you believe the anatomy, no, here the start curvature, start the curvature from here this way, no. So just finish this way, and here tissue will be much more. So why unnecessary I will start here from upper pole, easily getting the plane. Look here, already getting the plane, no? So always prefer the upper pole. Now slowly I am debulk the adenoid tissue. Hey, Mamun sir.
Sir.
Mamun, chale.
In audience, sir, I am Mamun, another Mamun. Mamun, lot of Mamun, sir, here and there.
Sleeping, but not so
you.
Look here, the debulk the tissue, you will see, slowly you will see the extreme posterior, no? Means bacopharyngeal fascia, and here the periostal. Look here, the periostal sheath. Now you see the periostal sheath? Yeah, beautifully, no? So, just showing the upper margin, or this is fenor. So this is the upper pole, completion of the upper pole. So now you see the huge tonsil. Look here, a huge tonsil. from here to here, no? So anterior to posterior. So now I will show the macropharyngeal fossa also. Here the fossa is there. So injure the muscle. Here the capitis longitudinalis muscle is there. Slowly, slowly just remove the area. Look, the ear tissue, no? Tuber tonsil or tuberosity. The big tuberosity, I will finish up later on. Now, just slowly I debunk and then I will go to opposite side. See, here if you do this way, there is a chance of bleeding. And look here, then control of tissue and control of your coblation is less. But if I same area, I will go opposite side. Look here the position. Look here the position, no? So depth is different, but you just start here, so all are same visible, no? So don't go your position, no? Don't go from lower pole, just go to upper pole, your shoulders will be more comfortable. So all time when you're under control. So this patient, I think, is not getting the tranexamic acid, no? Not getting, no? If you give the tranexamic acid 30 minutes before, then no RBC will be seen. Slight bit of IV.
There is a study before adenotonsillectomy operation, if you inject tranexamic acid, 25% bleeding will reduce.
This is my experience. If I put the tranexamic acid, film will be totally white. This type of oozing, no, slight bit of oozing with high magnification, this oozing not seen. Sometimes infected case, that is the different. But if you prepare, no, good antibiotic and also the tranexamic acid and nasal drop also. But nasal drop only for nasal cavity, no. Look here, if my assistant should the endoscope repeatedly, okay? Look here. Yes. So, yes, clean, no? So, unnecessary, you should not remove the repeated. জল বাড়া এই বাবা তোমার ইয়ে কেটে গেল বলে ওই প্রথমে ওখানে ডিসকাস করছিলাম দেখো নাও you see the why not working, look